Very good evening, friends. Meeting again in the session of Stuart Close Philosophy, and yesterday we have finished very important chapter from the Stuart Close, that is the scope of homeopathy. After learning exactly the horizons of homeopathy, now he turns toward the one of the important thing which is needed over there, the concept of the unity of medicine. And this is too important. Where Stuart Close has tried his level best to explain what is the importance of all those things, why it is necessary to have a very specific correlation, in fact, synergistic correlation, or a complementary relationship between different systems of medicine, at the same time, the different specific specialities in the medicine. And that's why he has written very important chapter, that is the unity of medicine. So we'll start directly with the chapter number 5 from the Stuart Close, page number 48. As our studies in the medicine penetrate deeper into the problems of each individual branch or specialty, one fact stands out with ever increasing emphasis, namely that medicine is a unit and incapable of real division into the specialty. The superior man in medicine of the future will not be a great laboratory worker, or the man who is known for his studies in the metabolism, or the expert gastroenterologist or neurologist or surgeon, or he who stands preeminently above his confreres in his knowledge of disease of the heart and arterial system or of the lungs, but the man who recognizes the fact that the truths derived from all the sources of the study and investigation must be interpreted as belonging to the patient as a whole. In other words, the internist who appreciates the unity of medicine. So, very big sentence to start with the chapter, and where he directly introduces what he wants to say. He says that there are many different branches of the medicine which are there. There are different specialists. For example, there are the specialists of the heart, there are specialists of the central nervous system, there are the specialists of the GI tract. Every organ, there are varieties of specialists. In fact, when Close has written this book, there were 57 different branches of the medicines were there. And today, it is beyond 150. We have specialists even for fingers, even we have a specialist for even for the nails also. We have a specialist even for the specific part. Every organ there is specialist which is there. And what has happened because of this is this fellow who is specialist in that specific organ knows only certain things about that organ only, and he forgets the rest of the individual. He never takes into consideration the holistic concept of human being. He forgets that he has to treat that individual as a whole, but he treats or he starts treating that individual locally. If you keep your eyes open and goes to the skin specialist and observe that how they treat, and now there are many potent creams and ointments, specifically steroid ointments are there, and everything is treated locally. This local treatment is hazardous because this is not the thing which is a local disease, but it is the product of the internal human being who has diseased and which is expressed on the skin. So you cannot treat that unless and until the internal human being is treated. But this concept is missing, and day by day it is missing. In fact, it is going in exactly the opposite direction when we form different branches of the medicines, and because of which we miss the human being, we miss the diagnosis, the general pathology of homeopathy in about the disease, and because of which we cannot treat them permanently. Unless and until the holistic concept of understanding the human being we used to use, it is not possible to achieve a cure. And this is to start with the chapter. He explains over there. The very important thing is what he has written in italics. Very important, the man who recognizes the fact that the truths derived from all the sources of study and investigations must be interpreted as belonging to the patient as a whole. So this is very important. You have to look towards the patient as a whole, the individual aspect of the human being, and then you can treat that individual. Then you can achieve a cure. In other words, the internist who appreciates the unity of medicine. What do you mean by internist? Internist means intern or something more than that. Internist is nothing but who used to look inside with his mental eye, with his sixth sense, with his understanding about the dynamics of the human being. He used to take into consideration the vital principle, the vital energy, the vital force, the mind, the emotions, the intellect, the understanding, the memory, logic, everything. If you start looking towards those dynamic things, then definitely you will understand that human is not only there in the parts, but human is as a unit. It is an individual as a unit. And that happens when you look towards internal side of the human being. The distinguished specialist will be one who regards his field of study in its intimate relationship to the body as a whole. So even though you become a specialist, you should not miss this concept of individualization, or you should not miss understanding the human being as a whole. With these witty words, Francis Marion Pottinger, AM, MD, LLD, FSCP, the most distinguished specialist in the disease of chest in United States, opens his great book entitled Symptoms of the Visceral Disease. Mistaken ideals, wrong theories, wrong practice, materialism, commercialism, and selfish competition, as well as the great enlargement of the field of medicine in advance of science, have led to the over specialization of medical profession, the disappearance of the general practitioner, and the stripping of numerous so-called non-medical cults and fads. So what he is giving? This is what has been written by one of the specialists at that time in the United States, and who has written a book called as Symptoms of Venereal Disease, and he has explained in one paragraph the thing which is going on right from his time, and today it is present. There are many branches which are developed. Now they are developing many and many more branches. And what is happening? There are many types of over specialization happens, and concept of general practitioner has been lost. The wrong or mistaken ideals, the word which he has used is very specific. Mistaken ideals, wrong theories. The theory has become wrong because it is very specific. If there is a finger specialist and if there is any problem related with finger, the patient goes to the finger specialist. She looks and he says, "You have going gangrene, and because of which you are diseased." If your concept is wrong, your treatment will be wrong. What you will do? If you say that you are diseased because your finger is gangrene, so you'll remove the finger because you consider that because of finger I am diseased. So concept, wrong theory itself is disturbing, it never cures. What happens after some time? The whole hand becomes gangrenous because disease never lies over there. Disease is centrally and gangrene is the result. But it is misinterpreted. It is interpreted that gangrene, because of gangrene, the patient is ill. But things are rather opposite. Because the patient is ill, the disease is expressing in gangrene. Wrong practice. The wrong practice because wrong theories. Materialism. This is again one important thing which has happened and which is present. What happens with the allopathic practice? They used to find it out the cause of the disease in the form of some material. And many times they miss because many times material cause they cannot find it out. It is very difficult to find it out prima causa morbi every time. And because of which they label, if the fever is there and everything test is found to be negative, then they label PUO, pyrexia of unknown origin. Many times, if all tests are negative, they label it is an autoimmune disorder. Earlier, it was labeled as an idiopathic disorder. Then it was converted into a autoimmune disorder. So names are changing, but ultimately you cannot find the materialistic cause, and that's why it becomes rather difficult to treat that patient. And that's why the treatment part, many times it becomes only a steroids. Commercialism, which is again developing more and more. What is commercialism? Commercialism is there with the profession. Everyone has become more and more commercial, and aspects are changing. It is not, it never remains to be a devotion. It remains to be a business. And last point which he has explained is selfish competition. It is not healthy competition. Many cults and fads have been introduced in the medical practice, and which is causing danger to the humanity. And this is the present state. And who writes it? This has been written by the person who is a well learned allopathic practitioner. In his book, in the introduction, he has written this. And that is what we have to understand. And that's why Close says it is better to unite together. It is not that just you understand the human being only with the local parts, local individual entities, but you have to understand that human being with every aspect, the holistic concept of human being. And here the homeopathy differs than the allopathy. And that's why next paragraph he starts with the name, the genius of homeopathy. There are 57 different varieties of specialists, one for almost every organ of the body, besides those who deal with many other subjects connected with medicine. In addition to the old-time allopathic, and eclectic school, which are still with us, we now have pharmacophysio, mechanico, electro, hydro, baleno, sero, vaccino, and radiotherapy schools. Not to mention the osteopaths, the chiropractors, and Christian specialists, and the mental, psychic, spiritual healers, all of whom are practicing medicine in the broad sense of the term. There are many varieties of practitioners in this on this earth. Now they are much more than that, what Close has mentioned. But everyone goes with their own way only. All those specific specialists, they work with their specific part, misses the human being. There was one case I want to illustrate for that. There was a patient, a lady around 40 years of age. She came with very severe pain over here in the left facial maxillary layer. And she was having very severe pain. And it was there since last 3-4 months, and she was absolutely harassed. And she came for homeopathic treatment. She said, Doctor, I started getting pain over here. So I felt that it might be because of toothache. So I went to dentist. Dentist examined. He took the X-ray of the tooth and they found to be normal. He said that there is no question of dental problem. You better meet the ENT specialist. Then she went to ENT specialist. He has again examined him. He asked the PNS view of the face and X-ray of the face in order to find it out, is there anything with the sinuses, and the sinuses found to be normal, there is nothing wrong. He said that there is no question of about your ENT problem, so it is better you go to dentist. She said he sent me towards you. Then he said that you must go to the neurologist. So she went to the neurologist. Neurologist examined. He has done all the neurological examination. Nothing found. Then he asked her that to go for EMG nerve conduction study. EMG nerve conduction study was normal. Then he said that there is nothing wrong with your neurological problem. So I feel that either you have to consult dentist or ENT specialist. She said already I went there. Then he said better to go meet psychiatrist. And she got frustrated and she came to for the homeopathic treatment. Everyone have looked to find it out what is wrong with materially over there. No one have looked what she is having the problem. She was having very severe pain. She was feeling very heavy over there. She cannot bend forward, and she was denoting this is the place where I'm getting very severe pain and I'm frustrating day by day. It is increasing. She was quite chilly, and this pain used to happen more commonly aggravated at around 1 to 2 a.m. And this is the totality with which she has presented. So she asked, what is the wrong with me? I said, wrong is that you are having the pain. Where it is, from what source it is, it doesn't matter. Thing matters that whether you get cured or not. That is the question. I don't want to find it out what is the cause. Instead of that, I want to treat you. She said, well, no one have given medicine because they have not come to some conclusion. I said, we cannot go on thinking or speculating the things that what is the cause. Instead, we match your symptoms with the medicine and we give the medicine. I am damn sure after 15 days you will be all right. And I started her on Calibicromicum 1 mg repeated doses. And within a span of 4-5 days, she was completely all right. She called me, doctor, your remedy has worked. I'm very happy. After 3-4 months, I'm really feeling well. This is the difference between, this is the genius of homeopathy other than this special. And this is the difference which he wants to explain, that you have to deal with the human being, not with his parts and not with his speciality. There is an old saying, it takes 9 tailors to make a man. Now we might say it takes 9 specialists to make a physician. If it were not, that 9 would not be enough to make good all-around physician of the old school. This is very, the funnily Close writes it, and that is very important. That, and what is the fad at present? There is a fad of group practicing. There are practitioners who comes together. One is from medicine, one is from surgeon, another is from the physiotherapy, then there is one laboratory pathologist, there is one who is gynecologist, one pediatrician, one neurologist. All those comes together, and what do? They used to just transfer one patient from another in this way without treating the individual as a whole. And this is the problem of the pathy at present, which never happens with homeopathy. With homeopathy, we never deal like that. We never deal that his ear is, there is a problem, or treat the ear. No, there is no question of treating the ear. Their treatment is individualistic. There is no question of treating the GI tract. There is, we have to treat the person as a whole. And this is basic difference between the rest of the pathies and the homeopathy. And that's why it never requires 9 tailors to make a man over here. Here it is individual homeopathy sufficient to deal with whatever may be the pathology over there. The people realize in a blind sort of way that they are getting from the medical profession a good many things they do not want, and are not getting some very important things which they need. Very important thing, very important sentence here. People want many times a cure. Such a patient who is having pain since long time and no one is treating her for that pain. But what she need not know, what she never needs, that she has got. She was investigated for the scan, she was investigated for the X-ray, she was investigated for the X-rays of teeth, she was investigated for EMG nerve conduction study, but nothing found wrong. So this is the things which they don't want, they are getting. The failure of surgeon and the organ specialist to do more than palliate or remove the tangible products of the disease. The rise of the seductive serum and vaccine therapy, and the reign of the reptilian-derived hypodermic needle, the disappearance of general practitioner with the system of medical education, which made him, and refusal of profession to accept the beneficent law of therapeutic medication, and its corollaries, initiated by Hahnemann, are the main reasons for the increase of quackery and Hamburg in the practice of medicine. and the rise of non-medical cults. There is rebellion and revolution in the medical world as well as in all other worlds. So these things have happened because no one was thinking about the patient. No one wants to serve eagerly. No one wants to serve the suffering humanity eagerly. There is no burning desire. The commercialism has entered into the field. Everyone was looking towards, yes, asking the patient to do such and such investigations which are not at all needed. Many times it happens. There are new trends which are coming. That is, we used to do your all investigations and do that in such and such package and all those things and whatnot. But what is happening? What is needed is missing. Patient is in need. Patient is in need of a remedy that is not given, but only the investigations have been done. That's why Hahnemann have written in first aphorism in the footnote, the modern science has become theoretic medicine, but not a practical medicine. There are many professorships have been offered to them, but no one was coming to treat the patient. And if you find it out, the truth is that for many diseases, there is no permanent answer. Right from the diabetes, hypertension, or any chronic disorder, there is no cure, there is palliation. And why this is happening? This is happening because everyone was looking towards the thing only with a specific angle and only with specific thoughts. If thoughts are wrong, the treatment becomes wrong. If theory is wrong, the treatment becomes wrong. And this is what has happened with the modern medicine. So we'll stop over here and we'll meet on Monday with the next part of it so that we can go ahead and learn many things in this specific chapter, the unity of medicine. So thank you being there. And today evening we're not going to meet for Matramedica session. We'll directly meet on Monday. Thanks a lot and good evening.
Thank you, sir. Have a good evening and good night.